So let's see. So since we have 6 people out of 12, I think we are good to call this meeting to order at 11:09 a.m. I sent out an email last week that included the agenda and draft minutes from the last meeting. Did you all happen to get that? I'm happy to kick it up to your inboxes if that's helpful.
Yep. Nope. Got it.
Wonderful, wonderful. So that said, going into the agenda, the first item is called order and introductions. So I'm Joe Carvalho. I am a co-chair of this committee. I'm joined by my fellow co-chair, Princess. You know, based off of our last meeting, it seemed as though we had a lot of work to do just in terms of getting our feet underneath us and making sure that it is that we understood what it is that we're charged with doing, and trying to get a better understanding of how to move forward. So this meeting is hopefully going to begin to address that. Princess and I have had several conversations since that meeting. We've probably met at least 3 or 4 times a week for the last few weeks, trying to make sure that we had a better understanding ourselves, and trying to develop a strategy that hopefully you all can help contribute to and will find helpful in understanding what it is that we're doing. So that said, before we dive into everything, I would like to see if we could just get the minutes from our last meeting approved. But before that, I wanted to raise the possibility of any adjustments being needed for the minutes. Did anyone have any revisions they'd like to propose? All right. Hearing none, I would entertain a motion to approve the minutes as presented.
Yep. Yes.
Okay, wonderful. I will, actually, give me one moment. I'm so sorry. I'm just going to make a quick note that John DiMatteo made motion to approve minutes as presented. Do we have a second for that motion?
Yes, you can put me, Joe.
Thanks so much, Claudine. I was really worried that was going to be contentious, so I appreciate us dodging that bullet. Thank you so much. So that said, we can dive into the heart of our agenda here. It's my understanding that Peter's going to be reviewing the first half of our agenda, basically. He's going to be doing a broader ARPA update, trying to contextualize the work that we're doing within the context of all of our sister committees. While he wasn't in attendance at our meeting with McDowell yesterday, I think the hope is that he can just touch loosely on what McDowell is aiming to do when it comes to all of our committees' work. And then Princess can give a little smaller update as to what our discussion was yesterday with McDowell. And then Peter is also going to discuss the residential and day incentives. So without further ado, I'd like to hand it off to Peter Mason.
Good morning, everybody.
Morning.
So I look at this, there's 2 pieces to this. There's the whole ARPA piece, which has a number of initiatives. And then within that, there's also the whole transformation of the settings that we're looking at doing. So when I look at the overall piece, let me just go through some of that of where we're at. This includes providing payments to providers for stability and workforce enhancement. And we've sent out 2 different payments to providers at this point. This was as the ARPA was actually to help with COVID and the effects of COVID, and that's why that first piece is important. It's probably the most expensive piece of the whole initiative for providers. And with all the workforce issues that are out there, this other piece of helping them to provide incentives, to provide longevity payments and stuff, was to try to make sure that we can get people to come, whether that's a bonus for them to sign up on, and then to help stabilize the workforce so people don't leave. So That's the biggest piece to this. Another piece to this was looking at expanding and integrating the use of assistive technology. And we've been working through that. We've issued and awarded $600,000 of grant money to individuals and providers to assist with purchasing assistive technology equipment. We're looking right now at a second round of that to go out either in December or January, because we heard a lot of people have been were looking to put in, but they didn't get a chance because of the timing piece. So we're extending that out because we really think that technology is another way to help us to maximize the staff that's out there and to help assist individuals in terms of more independence. One of the things we've also done is look at our respite centers, and so we're purchasing additional assistive technology equipment there. And the idea is that as families are using the respite centers, their individuals and loved ones will start to be able to experience some of that assistive technology equipment, so that they'll start getting used to seeing that stuff, so that whether that can then be duplicated in terms of the house or in their house or in a future program. So we're looking at doing that. We're looking at increasing the training for staff and provider staff, DDS staff and provider staff on using AT equipment and how that will assist in terms of assist individuals and to help increase independence. And we're developing a self-advocate training program that the self-advocates will be trained, and they'll be going around to individuals and training them on technology to help introduce technology to individuals. The program's called AT and Me. So we're in the process of purchasing the equipment now. Once all the equipment's in, then we will then train the self-advocates, and then the self-advocates will then go and train and work with individuals out in the community and to help introduce them to the technology that's out there. And lastly, we're looking at doing an RFP, which is a request for proposal, where we would establish 1, 2, or 3 companies. We're not too sure how many that would be the go-to agency if you're looking at needing an assessment for assistive technology, and can go. Case managers have to try to find out who's available, where can I get the technology assessment. We're trying to set it up so that either we have one for the state or one for each region, that individuals could go there, and within a certain time period, they will have to come in and do the assessment. And they would then come up with, well, these are the equipment that they would need, and using that equipment, this is how much it would cost, and that would then go to Pratt. And then once that Pratt agrees with that, then it would go back to the company. The company would purchase all the equipment. They would then install it and train the staff and the individuals on its use. So we're trying to move forward. It's kind of get stuck somewhere in the bureaucracy of approvals, but once that gets done, we'll be sending that out. And hopefully we can get that started as soon as possible. We've have issued a contract with a company. It's called Rewarding Work, that's going to be developing an employment recruiting network. Rewarding Work has done our recruiting network from previously, but this one now will be to expand that to be more updated. And that's our short-term solution. And our long-term solution, we're working on an RFP with our sister agency DSS that will be sending out to have a employment networking software system that would incorporate both the DDS and DSS individuals who self-hire and the staff that they're looking for. Some of the other things that we're doing is we're still reviewing the universal assessment. We've come up with what the where we're at in terms of the compatibility with our level of need tool. The issue now is we're looking at if we were to go that route, what would be, how would we implement it? Who would do it? And so we need to start looking at those questions in order to figure out timing and what we would need in terms of resources to get it done. The participant survey and improvement expansion, which is what we call our national core indicators. We have set up a memorandum of understanding with the Yukon Health Yukon Health, and they then will be conducting those surveys. In the past, DDS staff have done that. But we thought that this would be a little bit easier to have a third party to do it and go in. And not that we won't have some DDS staff doing it, because we will, but the bulk of it's going to be through Yukon and having them complete that. Then we're looking at the research and an installing of a new case management system. And we're in the process now of doing a planning document that we need to go through the federal government, and that then will be able to, once we do that, we'll be able to hire a contractor who will then go out and research what programs are available for this new case management system, and once they've identified that, we will then go back and purchase it and install it, but we have to go through that first. And then we're in the process of doing our critical incident upgrade for looking at our Medicare claims, and to make sure that there's an incident report for all Medicare claims that happened in a hospital. And if not, we then will go back and find out why wasn't there a claim? Why didn't we know about this? Sometimes it's a mistake that people have done, and sometimes we just haven't heard about this. So we'll be able to go back and find out how that slipped through the crack. And last, our outcome payment is part of our Deloitte consulting. They're doing research now as to what other states are doing. And as we start moving forward with our transformational system, they'll be then developing a recommendation of how we could set up an outcome payment to providers that will help us to improve our quality and our outcomes. So that I say that there's two pieces to this. Overall, the whole ARPA piece, and then we get into the transformation part. And so the transformation piece is what we're looking at doing is moving individuals from congregate settings to more independent settings. Specifically looking in for community living arrangements, which are group homes, or we call CRSs, which are community residential services. That's like a smaller group home, and we're looking at moving individuals from there out into more independent settings. And so we've contracted with Deloitte, And Deloitte is at this point working through the transition plans that would happen. And so we have done we've done a description of it. They're now finalizing that description. We've done the template. They've finished with that, and we're just finalizing some of those pieces. We're going to be doing so this. I should back up. We're going to do this in 2 phases. And so the first phase is providers will be able to provide a plan on the existing supports that we have now, while Deloitte at that point will also be, while they're assisting that, they're also going to be looking at other states and getting input from agencies and trade associations as to what other supports are out there that we may not know about or that we should be looking at. They'll be making recommendations, and once DDS accepts that, then we'll be looking at trying to convert our system to that and those new types of supports. So the first phase that we're looking at is providers can put a plan in based on our system today. The second phase will be once Deloitte finishes that and we've accepted that, providers will then be able to put a plan based on that. And what we've heard from providers is some people are ready to go right now and they want to jump into it. And there's other providers say, you know, I want to see what else is out there. And so that's why we're trying to put this into 2 phases. We didn't want to put pressure on people. But we knew that we needed to move forward. And so with the first phase, that's where we've come up with the transition description. We've come up with the template for that. And that looks like at this point, we're moving forward to starting that on December 1st with the first phase. And it'd be one of those first come, first serve people can put in as you go along. And that first phase will stay open until we get to the second piece to that when we hear back from Deloitte and all that. Now, what Deloitte is also going to be doing is...
Peter,
yes.
I'm so sorry. Would you do me the favor of just trying to encapsulate the difference between phase 1 and phase 2? And if you were about to do that, I apologize. But I think that's something that I have personally struggled with understanding. And maybe I'm the only one in the group, but I figured I'd just ask the question in case I'm not.
So phase 1 is basically people are going to be putting in plans on what systems we have today. And so they'll be using the same supports, the same rates that we have as of today. And they're going to move forward with. We've already received 1 plan from a provider already. When phase 2 is at that point is, all right, Deloitte's gone through this whole research and analysis. They've recommended these are other things that you should be including into this. And so that's going to be more of what the future of DDS will look like. And that's where the phase 2 comes in, is providers would put plans based on that future design. So you'll have the first phase is on the current design, the second phase is on that future design. Does that make sense?
Yep.
Okay.
Can I ask, this is Dawn DiMatteo. Can I ask one question?
Sure.
Is this the interim residential incentives that was included in our email? This is basically phase 1, Peter, if I'm understanding it?
That's
Okay.
correct. Yep.
Okay,
That's
perfect.
correct.
And then just to clarify, most of the moves with these individuals, obviously still the level of needs comes into play on where they would go or what you would be recommending.
Yes, the level of need comes into play. I think, you know, what we're looking at is we're looking to see how this stretches the system.
Okay.
And, you know, people right now, the way things are set up, some individuals who have a lawn 5, people may assume that they can only live in a group home. And I'll use that
Exactly.
as an example.
Yep.
but the supports that we've set up, so we have what a program called supportive housing is. There's an actual it's within a business, within an apartment complex, and there's a apartment that's been set aside for the company that runs this.
Yep.
And so there's a staff on board all the time. The apartments have all been outfitted with assistive technology based on the needs of the individual. And so the link between the staff and them is there, but it gives that individual more independence.
Exactly.
And so what we're looking at doing is, how do we stretch this? You know, we're not trying to interfere with health and safety and all that stuff.
Yep.
We're trying to figure out how do we set up some of these systems that allows individuals to be more independent based on what we have in the system today. You know, for example, you have individuals who may be able to cook simple things, but then they forget to turn the stove off. Well, there's a sensor that's on there that if you don't go near that stove in a certain time period, the stove automatically shuts off.
Yep.
So we can start looking at some of these pieces that will help individuals with that independence. And so that's what this is trying to do, is to try to stretch that.
Yep.
We also know that through the pandemic, we had a number of individuals unfortunately pass away, and there's a number of vacancies out in our system right now. So we have 800 group homes right now. And right now, of that 800, there's about 100 individuals. There's 100 vacancies out there.
Wow. Okay.
Which is a lot.
Yep.
And what we're finding is that there's this collision that's happening. We have a lot of people who need supports. We also have an emergency list that's out there, and that emergency list keeps growing.
Yep.
And so we have group homes that have grown up in the system, and individuals have lived in that system. But the individuals who went in years ago are not the same individuals that are going in today. And so sometimes what you're doing is you're putting an individual, the vacancy, it may have individuals who have some more cognitive issues, but no behavioral issues.
Yeah.
But the vacancy may be that the only the only referrals we have are for people who have significant behavioral issues.
Yep.
So if you put the individual in there, you're going to upset that house.
Yep.
And so what we're finding is that there's this collision that's happening, and that all these vacancies, and trying to match these is coming into resistance. Either the provider doesn't want to fill that spot, or people don't want, you know, to make that to upset the apple cart. So what we're trying to do here, so while we're trying to stretch the system one way, the other way we're trying to look at is, okay, what if we look at, if you can move some of those individuals to some of these other places, and that opens up that house, would they then be able to then redesign that house to be able to handle individuals who need more significant support needs?
It makes total sense.
So that's kind of that. So there's two pieces to this that we're looking at: either using the homes that we have and try to redesign them, or trying to move people out into more independent things. So it's both of these. So what we're going to see in these plans is you're going to see some providers closing homes, some providers restructuring homes. And so we're trying to give them the resources to be able to do that restructuring.
Yep.
So with all that, that's why we're all these things that we're looking, and we have this. The unfortunate part of this is we have a short time period to do this, and as you know, people with disabilities don't change easily. And so usually it takes a lot of time. So there's going to be some stretching of all this because, you know, we need to move forward because we have to maximize this dollars that we have and in order to assist the providers. So that's why you see some of this stuff, it looks like we're really trying to move this quickly and we're trying to go as slow as possible, but time is definitely a factor.
Yep.
So what we came up with is these incentives that we sent out to people. And the incentives were designed to give a push. And the best way to push is usually with money. Since providers do 90% of the supports, we figured, okay, if we can give them finances that will help push them to this, we're hoping people will take that and move this forward. And so when you look at the residential, you know, we're really encouraging people to reimagine what those supports would be, how you could do it. And so for each individual that moves out of a congregate setting, either the CLA or the CRS, we'll give them $33,500 if that person moves for 60 days. At the same time, we know, let's say you have a group home, that it's a 4-bed group home, there's a vacancy in there, we have 3 people there. If you move somebody out, that means the provider's not going to be able to handle the finances because now they're lost one person in that house. They've already down one, they're going to lose another. So one of the other incentives is we'll keep paying for that opening place, that open vacancy, as they move through their transition. So the first one moves out, we would then pay for that. We'd still pay their monthly amount. The second one out would pay their thing. And when the last one leaves, okay, now we can stop paying this because now you don't have any staffing that you have to worry about. And then now you can do your restructuring, closing the house or whatever. So we've got moving out, you get, if some person moves out, they'll get the $33,500. We'll pay them to help with the vacancy as people move out. And then the last incentive is when you move to someplace, so let's say you're going to go into that apartment setting, we're going to pay you whatever the standard rate is. And as an incentive, we're going to match that amount for 20 weeks because we figure you're going to need additional resources to help assist that individual into the new place. So if they go into an apartment and they're going to get 40 hours a week of individualized home supports, that rate right now is $38.80. They'll get that. And for every hour that they bill that, we're going to match that $38.80. So they'll actually get it twice that amount. So the incentive is, first off, we're going to give you the additional incentive. We're going to give you additional money to help with the transition. But, you know, if there's whatever dollars you don't need, you'll actually be able to keep and then reinvest someplace else. So that's what the residential incentives is. And that we're calling them interim because as we get to the new ones, there may be additional incentives we may find that these incentives don't work and we might have to do something else. So, but that's why we're trying it this way. That's in interim. And for the day is a similar one. There isn't one to move out. We didn't have that built in. But it's the same thing. If you have a day program that's a congregate day program, you know, it's right now in the facility. What we'll do is if you say, okay, you know what, I'm going to move 5 individuals into more community-based supports, and let's say into a group supported employment. So it's a group of individuals on a work site. we will pay, as that individual goes out, we will pay the vacancy that's in there for their current site so that they still can provide the supports to those individuals still there. And once again, on the site that they go to, if it's the group supported employment, we call it GSE, we'll pay the GSE rate, and then we'll match that as well for each hour they do. And that will match for like 26 weeks. So that's what those incentives are. We're hoping that this is something that will help people to move forward and to be more community based. And so that's kind of it in the whole texture of it.
Thank you.
Sure. Does anybody have any questions?
Hi, Peter. This is Sherry Knightley. How are you?
Hi, Sherry. How are you?
Good. I do have a question. I don't know if it's for this group or not, but since I have you, and it might help explain to everybody else, we have an agency in the West region that is running the Emergency Transitional Home,
Yep.
DPM.
Yep.
So they have an individual they were having difficulty finding placement for. So they've offered to develop a CRS for him. And we're encouraging them to increase it to a 3-bed. And they think they have someone that they could place from the emergency list into this 3-bed. Would they be eligible according to the residential incentives for taking somebody off the emergency list?
Not if they're going into a congregate setting.
Well, I forget what page it is, but it says that if somebody comes out of the West Region emergency list, then and goes into a vacancy, they would get the incentive.
Yeah, they would, except there had to be a person that's moving out into an independent setting.
Okay, so the key word is it has to be an existing vacancy, not a new home.
No, I think the key word is that if there were 3 people in that CRS and they moved one of those individuals into a non-congregate setting,
right,
that individual is the one that gets that they would get the incentives. The person coming into that spot does not get the incentives. But what we're trying to do is to help people move out, to give those openings for people to take off of the emergency room. I mean, the emergency list.
Okay, well, in this case, they're gonna ask for permission to develop a new one because we can't get these folks placed.
I get that, but that's not what this initiative is for.
Okay, all right, thanks. Thank you for the clarification.
Sure.
Any other questions for Peter in just the ARPA update more broadly? All right, Peter, thank you so much for that update. I can imagine there might be additional questions that might come later. But
if
as always,
anybody has any, they can always email me. Just let me know. We're trying to get. We're doing a lot, and we just want to make sure people hear what we're doing. So.
Yes.
This is Dawn DiMatteo. Thank you, Peter, for explaining that. That was really helpful. So have the providers been sent this intern?
So this is where it gets a little funky.
Yep.
Is that we have committees, and so we have a working day committee, a working residential committee. We have an advisory committee, and then we have the 2 engagement committees.
Yep.
All of those committees are technically public hearings or public meetings. So we have to tape all those, and all the information we give is public. We haven't gone to each provider and said, this is what we're doing, not yet. I mean, that's what we'll do as of December 1st. But I'd be surprised if they haven't seen it yet, because all of it's public information. So, like the advisory committee, they've our res committee approved the residential incentives. Our day committee improved the day incentives. The advisory committee oversaw those. So I mean, all that stuff has been out there. So I think providers have seen that. They know what we're doing.
Yeah.
Now, there could be an agency that's got their head in the sand and doesn't want to know about it. That's up to them. But most people should know.
Okay, thank you. I was just more curious than anything else. Thank you very much.
But just to, this is Princess Russell Raynor, DDS. Just to also add to it, Peter, the in the phase 1, how you explained is for the providers that are participating in phase 1. Deloitte is also working with them on their transition plans as a template that Deloitte is putting together for the transitional plan template to help those providers then figure out how to put their own plans together for their own transformational process. And then when phase 2 comes, we will have worked out many of the kinks, many of the concerns and issues with the providers that are participating in phase 1 to then help strongly encourage the providers that come into phase 2 with moving this forward and developing their own transformational plans, right? So, so that's what's happening too, as far as why we haven't reached out to providers yet. Deloitte, one of the consultants that we hired, is working on a template transitional plan, which will assist providers in coming up with their transitional plan, their transformational plans, which is going to be a huge guide for them and necessary. So I think that's part of the piece too there.
Yep. Thank you.
Yeah. And as far as I know from case management, I know providers are actually listening in and they have viewed the committee's recordings too. So some of them are out there. They're aware of it, and they're reviewing it. So they're staying abreast of kind of the developments, new developments. Okay, so if nobody has any other questions, and for the sake of time, I want to kind of get through some of the other topics we had on the agenda with Joe and I. And so, Peter, you did mention McDowell, kind of just what McDowell, the communication firm, and Deloitte, the transformation planning firm there, what their roles are, kind of how they will be interacting with the committees in this process. Just want to make sure everybody understood that.
Yes. And McDowell will be, there are communication consultants, and at some point they'll be coming to this committee, and I believe it's going to be, Joe, they're just hearing this now, but it should be on December 7th they're coming. One of the things that they're coming for is they're going to be doing a survey and asking for people's opinions to help them with phase 2. And so they'll be coming on December 7th to help present that. We look at the communication consultants as a big assist to both engagement committees to help what we need to communicate, how to communicate it. So this will be the first contact that you guys will have with them. But we see them being available to this committee as much as needed.
Okay, and Princess Russell Raynor here, DDS, just wanted to jump in and discuss that, as part of the agenda, that we actually met with McDowell yesterday as co-chairs. So the engagement committee co-chairs, individual and families committee, and Joe and I met with them. We met with Rebecca Brockway and Maura Fitzgerald, the senior vice president of McDowell Communication firm. And we discussed, we just met to kind of orient them to our committee's roles and our goals. We wanted to also update them on kind of what's taken place so far, as far as updates with ARPA, kind of where we are now, what's been communicated internally so far. And we've had three internal communications that's come from Jordan initially back in June, July. And then we also had one from Joe and another one from Kevin, our communications director, recently, which we also shared with you in the last email update. And so we discussed that, and we, in talking with them, we really wanted to for them to help us make sure that our communication as far as what we're sharing and the individual and families communication as well align, and they're consistent in the messaging. And that when we're sending out our updates, that individual and families are sending out their updates, we want to make sure that it's timely, focused, and consistent. So we also determined that in the future, it would be beneficial for us, the co-chairs, to meet once a month, and that, our goal is to make sure that we are properly informed as to what's happening in the other committees. And so it would be also beneficial for them to provide a bi-weekly update as to what's taking place in those other committees, so that we have that information in one place, concise, and we can also take it back to our committee so that we can kind of figure out, who do we need to get these updates to, when to get it out, and so on and so forth, so we can do our job. We also, McDowell also communicated that they will have one of their staff folks listening in on our meetings, just participating as a member of the public, and in the future, upon request, we can have them participate in our meetings and maybe, do something a little bit formal, maybe ask questions, but we'll determine the parameters of that moving forward. And so, what else? That was the extent of it. I don't know if we had anything else. Did I miss anything, Joe?
I think that was a good representation of what the meeting was. I mean, it was primarily introductory in nature. And I think something that both Princess and I share is, while we're working on this huge project that is the task and the important task of communicating these huge transformational updates to DDS staff in a way that's digestible, we ourselves need to make sure that we're getting updates that are digestible. It's hard enough to attend these meetings, and we appreciate everyone taking the time out of their day to attend these meetings, but to listen to 3 other meetings that, amount to be hours, it's a bit of a challenge to stay on top of everything that's going on. So we're hoping that our partnership with McDowell Communications will not only help us better communicate what we have to share with DDS staff, but it'll hopefully keep us and our sister committees better aligned as we continue to make steps forward. So Princess, thank you for that. Princess, if it's all right with you, I was considering going into the next portion of our agenda, the communications planning. Is that okay?
Yes, that's perfect with me. We did want to let you guys know too that we also discussed this, what Joe was about to present to you. We discussed it with McDowell as well and got some really positive feedback on it, but we wanted to present to you guys. You can go ahead, Joe.
Okay, wonderful, wonderful. So I had attempted to try to save this into a PDF to make it a little bit easier to share. That said, I have no idea where that was saved to. So I'm just going to share the actual Excel document. I appreciate you all rolling with punches here. So let me just share my screen for a moment. Let's see. All right. Yeah. There we go. Okay. Let me know when you all can you can see it. Perfect. Wonderful. Hopefully it's legible and not microscopic either. So last meeting, we had this conversation about how best to communicate and how best to kind of conceptualize what it is that we're communicating to DDS staff. So Princess and I took some time and tried to figure out the what we're communicating, the who, the when, the how, and all of those fundamental questions that make up our mission. Where we started was on the DDS webpage. So we went to the DDS website. We wanted to see what was already out there. So we reviewed the webpage and we found this helpful link right here, specific components related to the DDS initiatives, which breaks out basically DDS's approach to the ARPA initiative very nicely into 6 broad categories. Those 6 categories are as follows. Forgive me if you're familiar, but for those that aren't, I just want to quickly name them. 1, we have enhance the HCBS workforce, and forgive me, is that home or is that health? It's home, right? Home and community?
It's home, yes.
Thank you. Home and community-based services workforce. Number 2, we have expand and integrate the use of assistive technology. 3, we have enhance self-direction. 4, enhance and expand HCBS delivery transformation. 5, enhance provider infrastructure, and 6 is strengthening quality. So with those 6 broad categories in mind, and with us trying to make sure that we're in line with how the agency's already defined our involvement with ARPA, we want to make sure that our communication, what it is that we're communicating as seen in column A here, matches those 6 categories. So basically all future communications are going to fall into one of those 6 categories. And again, for why are we focusing on these individual categories? We again borrowed that straight from the website. You can see 2 bullet points right here. Funding to temporarily increase HCBS provider rates to help rebuild, improve, stabilize, and maintain provider workforce. That's exactly what we have here in our purpose. So we have the what, which is those 6 categories, the why, and here are the potential audiences that we intend to share this information with. I think in general, we intend to share these updates at least, here's the floor of what we intend to share. And the ceiling can go as high as we want, depending on what actually needed in terms of our communications. But the floor is that we'll be communicating at least quarterly, and we'll be communicating at the very least via an all staff email address. That said, we understand that some staff do not have access to email. And in that instance, you can see in our column that explains how we'll be communicating with staff. We have other tools at our disposal, like read and sign memos. That's how the agency communicates important updates that need to be communicated to frontline staff who do not have access to email. So in the event that we need to communicate updates to frontline staff, we can always do something of that nature. And again, frequency, we intend to share at the very least a quarterly update to all DDS staff via email. But as needed, say there's an important update for case managers or for resource managers, we can send an email to those subsets of employees. You know, for example, Wayne Seidel leads the case management division. You know, we can ask him to share any timely information that's needed for case management via his email. So this is a broad overview of what our committee's mission primarily is to communicate important updates within these 6 categories to all DDS staff on a regular basis. So I think this is a helpful way of contextualizing our work together. And I think it's something that we'd like to share on our website, just as a kind of an explainer of what it is that we're doing. That said, this tool is both internal and external. I just described to you the external function of this and just sharing that, oh yeah, this kind of lays out what it is that our group does. However, it can also be an internal tool for our own use as we continue to meet into into the next year. So that said, these are some updates that Princess was kind enough to draft in terms of these 6 broad categories. We'll share these with you, and we can discuss these if you'd like, but for the purpose of a broad update, I'll just kind of loosely just show you the fact that we have an update that we would like to share with DDS staff. Again, we'll share this after the meeting. But so this is something that we'd like to you know, continue working on and then eventually share with for a Q2 update. We're in the second quarter of the fiscal year. But here we can use this as a kind of a repository for all of our communications going forward. So what did we communicate last quarter? Is there anything different that we need to communicate next quarter in January? So that's something that will help us keep track of what has been communicated, when, to whom, how, etc. So that said, I think this is like a helpful bird's eye view tool to kind of keep us on track and to keep track of what we have said and to whom. Any questions, suggestions, glaring omissions, any feedback more broadly? You know, it's not exactly rocket science what I've done here, but I think it'll help keep track of things. All right. Well, that's I
think it looks great. Nice job.
Thanks, Peter. Appreciate it. No, I think we'll have more to touch base on when it comes to these communications. I think one of my concerns that I had last meeting that I was a little leery to admit was that I wasn't quite sure what it is that we're communicating. And to be honest with you, that's still something I'm wrestling with. So I just wanted to let you know as a fellow committee member that I too kind of struggle with that. And I'm still digesting the information myself. And as I can, and as Princess can, we're trying to review the website ourselves to make sure that we're familiar with what the other committees are doing, to make sure that we're including the important updates that we are. But Princess, do you have any sort of summary of that you'd like to provide the group in terms of the updates that you have written here, or do you have any sort of anything you'd like to add when it comes to these specific updates?
Hi, Princess Russell Raynor, DDS. So Peter gave the updates that are exactly written inside here, this spreadsheet here. So there's nothing different to add, and that's the real wonderful thing about it. The benefit of receiving the biweekly updates as well from McDowell and from the other committees is going to be helpful to us to be able to do our job. Right. So as they send us the updates, to avoid us from having to go and take notes and then compile it, discuss it, articulate it, and try to, then transfer it here, they're going to provide us with what those updates are. And then we are just going to, take it back to our committee and decide, hey, do we need more information? Is there anything more or less we need to add? Who do we need to communicate this to? When do we need to get this out? And it'll help our job, be much easier. And we can be more focused on what it is that needs to happen. And I think it's a spreadsheet will be helpful to kind of help us to keep track of what we've already communicated, kind of where things are and how we need to move forward. And we would be, I think we discussed that it would make sense to develop some sort of a memo or email directly from this tracker sheet here. So, and it'll be helpful because everyone in the committee will have the same information. And you can go back and kind of see, what we communicated before and all that. So that's really all I had to add about that. There's nothing additional for me to explain because Peter took the opportunity to give us a very, very detailed update. So we were grateful for that.
And Princess, actually, I'm glad that you mentioned the memo that we hope to share, because that was just one other quick thing I wanted to touch on. I actually, the email I had sent to you last Thursday, including all the meeting information for today, which I've shared on the screen just here. I think this is a little bit of a preview of what I'm hoping to do. It's not identical to what we hope to include in an all-staff email, but we're starting to experiment different ways of communicating information. And I think when we send out these updates, I think what we hope to do is to provide basically a one-stop shop for you to be able to get information on all of the different committees. So this is my first stab at that, at doing exactly that. So I have each committee's main page here, and then underneath each committee, you have a link that will bring you directly to the most recent meetings that they've had, which also include video recordings and in some instances, even the actual presentations themselves, the actual PowerPoint presentations, so that you can actually download them and look along as you're watching the video, or just looking over the minutes if you don't have enough time to actually watch the entire video. So we're hoping to provide all this information repeatedly in different ways to ensure that people are, at the very least, have the opportunity to access this information at their fingertips, and making it as easy as possible. It's one thing to tell people, yeah, go to our website, it's all there, but to really put it in front of people and make sure that it's as accessible as possible, but also laid out in a very easy to understand way is something that we hope to do.
This is Peter Mason. So I know the individual and family engagement has started a write-up of the transition description piece. I think they shared it with the group yesterday. That may be something that could be built on here as well, in order to send that out as well, so that people are getting that. Because if we're starting with phase 1 in December, we should be getting something out to people, so that the staff at DDS knows, okay, phase 1 has started. This is what it is. This is what we're doing. So I think, that would probably be a good start to get that, so that we get something out to our staff in terms of where we're at and what we're doing. So as I said, there's two pieces to this. There's the overall ARPA piece, and then there's the transformation piece that's within the ARPA. And I think you may have to make sure that we're giving the details that we need for those different components.
Right. If I'm being fully transparent, I think a lot of what I hear about ARPA in these conversations, and even in the summary that we're talking about, that you gave at the top of this meeting, Peter, is that I struggle to understand what specifically will be needed to be shared with case managers. I feel like a lot of what I hear is geared towards the provider community. And not necessarily how case management will be relating to like what case I feel like
Right,
Princess.
that's the point is that the stuff needs to then get, that's what this committee is, to make sure that what's getting out to our staff is in a language, in a format that they understand what's happening, and so that they then will have that information to know what's going on in the system. So that's what this whole committee was to do, is to take that stuff and reformulate it and in a way that quick, decisive, that people can look at, oh, okay, this is what it means, and then they can move on. And then if you need more information, this is where you get it from, but here's what we're looking at.
Right, this is Princess here, DDS. I think we're in good shape with that so far with the information that we've received so far. We haven't gotten into the details of the information coming from day incentives and res incentive, those committees as yet. So, once we start receiving that information, we can decipher that when that happens. We did, though, work out with Peter. He was very helpful in providing a more concise one-page description of the residential and day incentives, because for me it was helpful then to go through a PowerPoint slide just to have one cheat sheet, which we'll also be sharing with the committee as well. Just kind of at a glance. So that's another way, just describing exactly what you were talking about, Joe, and just how we're going to make this information a little bit more friendly for folks, a little bit more digestible for folks. So that is one thing we're going to be sharing. That is certainly a focus for sure. I think everybody's in the same boat. This is a wealth of information coming at us all the time, and we're charged with the very heavy responsibility of making it digestible for everybody else. So we really appreciate all of you guys' input and just, help collaborating together, with everybody's expertise and really kind of putting this information together and understanding and asking the questions that need to be asked, because it's very helpful, so that's what we're going to be working on. When we follow up in the next email, we'll be sending that out. We'll be sending the PDF of the tracker sheet as well, so you can take a good look at it as well and follow up with any feedback. And then for the sake of time, because I know we're running over, I did want to get through the other agenda items, which is just future. Oh, sorry, Joe. I know you had something to say. It looked like.
Oh, I was just about to go into exactly what you're describing. So.
Okay.
Go ahead if you would like. No worries.
Okay. All right. So for future agenda items we were talking about, we did reach out to Trevor Rogers and Tom Marinac to invite them to come and present the day incentives as well as the CCH incentives for us. And so we're waiting for them to respond. I think it'll be beneficial for us to understand directly from those folks on what these are, and help us to understand better on how to communicate this information and the relevance and who needs to know what. So we're going to be pursuing other staff to come and present other incentives for us as well. So that's to come. And we wanted to also discuss the 2023 meeting schedule, which is coming up. Right now we're meeting every 3 weeks. And we were proposing to meet every 2 weeks. We're hoping to keep the same Wednesday because it seems to work for everyone and the same time at 11 o'clock. But as we move forward to phase 2, it's going to be more information coming out. It's going to be more actions going on. We're going to need to meet more often. We thought it might make more sense to meet bi-weekly and cancel meetings as we need to if we feel like we're in a good place. So we just wanted to put that out there and see what everybody thought about that. Anything, Joe, you wanted to add to that?
Yeah, the only thing I would say is that because this is something a little bit more of our formal piece of our agenda, we may need a motion to entertain. We might need a motion to actually change our meeting schedule, because currently it's every 3 weeks. So I would entertain a motion to make, beginning in January, make our meetings bi-weekly, so every 2 weeks. Instead of 3 weeks. Would someone make that? Is someone willing to make that motion? It can be anybody.
I'll make that motion. It's Dawn DiMatteo.
Oh, I love it.
I'll second.
We got like a first, second, and a third. This is
I know.
fantastic.
No pressure, but I'll make it.
Wonderful, wonderful. So I'll put Dawn DiMatteo and I'll put Peter Mason as a second. Let me just jot that down. Dawn DiMatteo, Peter Mason. Seconded. Thank you so much, everybody. I appreciate that. So we'll plan to do that. And again, I think in the beginning of January, we might find ourselves in a position where we are canceling every other meeting. Oh, Peter, go ahead. I'm sorry.
I think you have to vote on it.
So right. So there was a vote. There was a second. All in favor, say aye.
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 Those opposed? Any abstentions? All right. It seems as though it passed unanimously. I appreciate that, Peter. Thank you so much for keeping us. Thank you for keeping us on track, both with as it pertains to ARPA and to Robert's rules. So that said, I could foresee a situation in which my computer has done something strange here. I don't know why, but I can foresee a situation in which that we're going to be canceling every other meeting or so in the beginning, and as things start to ramp up, as we get further into 2023, we'll probably start keeping that bi-weekly cadence. So anyways, I'll be sending out a fresh calendar invite, so be on the lookout for that. And I think that's about it for that portion of the agenda. We have
one quick thing. Princess here, DDS. Just as a matter of action, just wanted to let you guys know that we planned, when we send the tracker sheet with the updates for our committee to review them, please respond with feedback and let us know, if there's any any edits, as far as context in content, if there's anything missing and those kind of things. We'd like to take some action and send some information out. Also want to see if I can work on getting my hands on the individual and families letter or memo that they're going to be sending out as well, so we can see that and have, get some feedback too, to see maybe if there's something we're missing or we need to add, or maybe it's something we can also share internally so that our staff internally know what's being communicated to individuals and families, and go from there. Just wanted to add that really quick.
That's great. I just lost the agenda, so I'm not quite sure what that last item was. Princess, might you happen to have that?
It was just suggested topics from ARPA, from our committee members. Any future suggested topics or anything you guys wanted us to follow up on, clarifications you'd like to see, actions, anything. And also the announcement for the next meeting, which is December 7th at 11 o'clock. Any follow-up, guys? Any comments? I don't know. It was a lot of information today. It was a lot of information today, but we hope that everyone is in a better place, kind of understanding kind of what we're doing, feeling that, things are a little bit more structured, and we're a little bit more focused on how we're moving forward and starting to take some action and really move this thing forward.
I think this meeting was primarily to kind of set a vision forward for what it is that we're doing and give some shape to it. What we fill that shape with, I think, is something we'll be discussing a little bit more at our next meeting and meetings to come. So while this is a 10,000-foot view, I have a feeling we'll be zooming in as we continue to meet. So I appreciate everyone taking time out of their day to join this meeting and to give their feedback and to bear with us as we're getting up off the ground. But I think we're starting to move in that into a direction and giving this project a little bit more momentum. So anyways, thank you everyone for joining. I think that concludes our business today. I'll just open up the floor one last time in case anyone has any questions or comments. All right, seeing none, I'll entertain a motion to adjourn.
So moved.
All right, wonderful. Thank you, everybody. Have a great rest of your day. This motion does not require a vote.
No.
Happy Thanksgiving, everying.
Yes, happy
Thank you.
Thanksgiving.
Yes.
Okay.
Thanks, everybody.
Have a
Take
good
care. Have a great
afternoon.
rest of your day.
Bye.
Alrighty, bye-bye.